I am Dr. Reem Atwan, consultant pediatrician at Primary Care of Johns Hopkins Aramco Healthcare. Breastfeeding provides passive immunity to the babies, and it's essential in the baby's growth and development, particularly brain development in the first 2 years of life. This is for the baby, and for mothers, breastfeeding beyond 1 year lowers the risk of breast and ovarian cancers and lowers the incidence of high blood pressure and type 2 diabetes. Breastfeeding to be started within 4 hours after birth and on demand after then. The baby usually feeds 2 to 3 hours during the first 2 months of life. Each breastfeeding session will take about 20 to 30 minutes. The baby's weight gain and the number of wet and dirty nappies will reflect if the baby is getting enough breast milk or not. Cracked or sore nipple, breast engorgement and infection, insufficient production of milk are the most common challenges, and they can be simply managed by educating mothers about proper nipple care during pregnancy and proper breastfeeding latching after them. Both the mother's nutritional status as well as her diet may influence breastfeeding composition and then nutrient intake in the infants. That's why healthy diet and lifestyle are recommended during pregnancy and lactation. The most common cause of pain while breastfeeding is improper latching. So the mother should stop nursing, reposition the baby to get a better latch. Other than poor positioning, dermatitis, infection of the nipple or the breast, vasospasm, hyperlactation are common causes of pain and can be managed easily with the instructions of the doctor. Frequent pumping sessions and keep breastfeeding your baby as often as possible when not at work. This will maintain adequate milk supply. At room temperature, the milk can be kept for 4 hours, and room temperature means 25 degrees centigrade or colder. In the refrigerator for up to 4 days. In the freezer, we can keep the breast milk up to 6 months in best, and up to 12 months is acceptable. According to the WHO and American Academy of Pediatrics, infants should be exclusively breastfed for the first 6 months of life. With the addition of complementary foods, breastfeeding should be continued until 2 years and beyond. Breastfeed the baby in a quiet and dark area away from any distractions. The mother may hand express the milk or pump to maintain milk supply before starting feeding. Try different positions until she finds one that works for both the baby and herself. Providing help, support, and love in all possible ways, both psychological and physical support. Keep the room dark and the baby close to you. Breastfeed on demand, no longer than 3 hours in the first 2 months, then longer stretches of sleep up to 6 to 7 months. Many babies skip night feeds when food are introduced. Frequent pumping or expressing milk frequently, adequate hydration, galactagogues like herbs, and some medications can be prescribed by the doctor. It depends on the illness. If the mother has a cold or flu, diarrhea, or even mastitis, she can continue breastfeeding. The baby will not catch the illness from the breast milk. In fact, the breast milk will contain protective antibodies. However, some serious illnesses like untreated HIV, tuberculosis, brucellosis, breastfeeding is contraindicated. The mother has the option of feeding the baby simultaneously with one baby attached to each breast at the same time or separately. Increased demand and consumption will increase the production of the milk. Almost all medications transfer into breast milk, and this may carry a risk to the breastfed babies. However, most medications are safe to give while breastfeeding. The doctor will inform the mother if the medicine is allowed during pregnancy or not. It may prevent pregnancy in the first 6 months if the baby is being exclusively breastfed, but it's not 100% reliable. Breastfeeding is the best thing mothers can give and provide to their babies. I'm looking forward to seeing every single mother breastfeeding her baby, and if you need any consultations, if you have any inquiries about breastfeeding, don't hesitate to consult your pediatrician.